To function properly, our brains rely on a continual flow of oxygen, which is carried in our blood. When this blood flow is temporarily reduced, you may feel a little dizzy, sick, or just odd, and if it's reduced for long enough, you may actually faint. There are potentially many reasons why someone may faint, and these include anxiety, hunger, pregnancy, stress, tiredness, pain, being too hot, or long periods of standing or sitting, which causes the blood to pool in the legs, reducing the amount of blood reaching the brain. If someone thinks they're about to faint, help them to lie down immediately, as this will help to restore the blood flow to the brain. It's not advisable to just get them to sit down, as fainting while leaning forwards risks them falling and hurting themselves further. If you're indoors, ask someone to open a window, as fresh air may help them to recover. When someone has fainted, lay them on their back and raise their legs about 30 centimeters. Keep them supported by either resting their legs on your shoulders or by using a box or a bag or some other object to support them. This will improve the blood flow to their brain, and normally they'll recover quite quickly. As they're starting to recover, calmly tell them what's happened, as they may be confused or disorientated. When they're feeling okay, help them up in stages by standing them up slowly, as if you stand them up too quickly, it may cause them to faint again. If they do feel faint while trying to get up, lie them down and raise their legs until they fully recover. If they do not regain consciousness quickly, open the airway and check for breathing, then follow the process for treating an unconscious casualty. It's not necessary to ring the emergency services unless the person has fallen and hurt themselves or does not gain consciousness. However, it may be prudent to call a family member or friend to escort them home. If the casualty is in the late stages of pregnancy, they should lay leaning towards their left side, as this will help prevent restriction of the blood flow back to the heart. Regular fainting may be due to an underlying health concern, so should fainting occur often, or if you're at all concerned, it may be best to speak to a doctor. If someone faints during exercise or has a seizure after fainting, you should always alert the EMS.